Hi, and thanks for tuning in today. I'm Lisa Almaguer, Communications Manager for Butte County Public Health. It's been a while since our last COVID-19 update, and a lot has changed and will be changing in the near future. Today's update will include information about the Pfizer vaccine authorization process for ages 12 to 15, current data about COVID variants in California, vaccine status of people living in Butte County ages 16 and older, updated masking guidance, and talks about the governor fully reopening the state in June. So there's been a lot of coverage in the news about the Pfizer vaccine receiving the emergency use authorization for persons 12 to 15 years old from the FDA. I will refer to the emergency use authorization as the EUA in this conversation. So I'll explain a little bit about the approval process and what it looks like for expanding vaccine eligibility for these younger ages in Butte County. So today, the Advisory Committee on Immunization Practices, also known as the ACIP, will hold a meeting to review the EUA approved by the FDA for Pfizer. After reviewing the application, and if they agree that the EUA should be approved or authorized, the ACIP will make this recommendation to the CDC. The CDC would then need to adopt the recommendation and publish it. So once published by the CDC, we have an extra layer of vaccine safety review for California and all of the Western states. This work group is called the Western States Scientific Safety Review Work Group, and they will conduct their own review. So if authorized by this Western Safety Review Work Group, the Pfizer vaccine would be authorized for use in California for children ages 12 to 15. Butte County will follow these recommendations and any authorizations made not only by the CDC, but the Western Work Group, and offer the Pfizer vaccine to persons ages 12 and older. So as you can see, there are multiple review and approval steps that must be met before the vaccine can be expanded to younger ages in California. We don't know exactly how long this process will take, but we anticipate this could be as quick as the end of this week or sometime early to mid of next week. So now for an update on our vaccination numbers for Butte County. As of Monday, May 10th, 43.9% of people living in Butte County, ages 16 and older who are eligible for vaccination, have some level of vaccine protection. So this includes 35.8% who are fully vaccinated and 8.1% who are partially vaccinated or have received one dose in a two-dose series. This is great news, but in order to reach herd immunity, we need at least 75% of all Butte County residents, not just those who are eligible for the vaccine, to be fully vaccinated. So if California does authorize the vaccination of persons 12 to 15 with the Pfizer vaccine, this will help us expand the number of people eligible for vaccination and help us increase the number of people vaccinated in Butte County, working towards that herd immunity. So every little bit helps. So I'll move on to variants and which variants are predominant in California. So getting vaccinated continues to be the best tool for fighting COVID, especially with variants on the rise. The California Department of Public Health tracks variants in California, and current data suggests that the B.1.1.7, also known as the UK variant, is currently the predominant strain in California. B.1.1.7 is more transmissible and may cause more severe illness than the wild type COVID or the original strain of the virus. The good news is that all three vaccinations available, Pfizer, Moderna, and Johnson & Johnson, are effective against B.1.1.7. We do have B.1.1.7 in Butte County. It was identified in early March, and we did let the public know about that. There are likely more cases of B.1.1.7 that have gone unidentified in the county. This is because not everyone who tests positive for COVID-19 is tested for a variant, as variant testing is somewhat complex, and at this time, few labs can test for them. There are many locations throughout Butte County to get vaccinated. The best way to protect yourself from COVID and any of its variants is to get fully vaccinated. And you can view a list of all of these locations on the Butte County Public Health COVID vaccine website. That's buttecounty.net/COVID vaccine. So we'll move on to the state's updated face covering guidance. This updated guidance replaces the guidance that was issued back in November, and it talks about guidance for fully vaccinated people and for unvaccinated people. So for fully vaccinated people, face coverings are not required outdoors except when attending crowded outdoor events such as live performances, parades, fairs, festivals, sporting events, or other similar settings. For unvaccinated people, face coverings are required outdoors anytime physical distancing cannot be maintained, including when attending outdoor crowded events. In indoor settings, outside of your home, including places like public transportation, face coverings continue to be required regardless of vaccination status. There are exemptions to this, and they include people under 2 years old, people with medical conditions, mental health conditions, or disabilities that prevent wearing a face covering. So for fully vaccinated people, you can visit without wearing a mask or physical distancing with other fully vaccinated people indoors or outdoors. And you can visit without wearing a mask or physical distancing with unvaccinated people, including children from a single household who are at low risk for COVID-19. And this is indoors or outdoors. So some nice updates to the face covering guidance, and especially for those who are fully vaccinated, a little less time wearing the face covering. So let's talk about the governor's announcement to move beyond the blueprint for a safer economy framework. This is the color-coded tier system that we've been adhering to, which is based on our case rate and our test positivity rate, kind of moving up and down that color-coded system, which tightens and loosens restrictions, especially on our local businesses and our economy. So let's talk about what this means. If this happens, businesses would be able to return to usual operations with common sense public health policies in place, such as mask wearing, testing, and vaccinations. With the reopening of everyday activities and businesses, this kind of brings a perception that the fight against COVID is over. This is very much not the case. COVID is still circulating in our community, and as previously mentioned, the B.1.1.7 variant is on the rise. So while the color-coded tier system may go away, all of the guidance and measures will still be in place. And this includes the state mask mandate in certain situations, especially for those who remain unvaccinated. Testing will still be recommended. Contact tracing and testing to detect cases early and contain spread will still be happening, and vaccinations strongly encouraged. So that is the complete update for today, kind of bringing you up to speed. I know it's a lot of information, and I thank you for sticking with me. Until next time, stay safe, stay healthy, and get vaccinated as soon as you can. Thank you.